Okay, so starting with today's session. Okay, so can you hear me? Yeah. So starting with the session, and today's is the session is the continuation of image based cadaveric series which we have started, and already I have completed the 2 cadaveric sections and cadaveric images discussion. So you can view the previous one also. Okay. So, and myself Dr. Monalisa. Now coming to, this is the introduction of my part. Okay, I have been teaching the FMG aspirants, NEET PG aspirants and UG students from the last 7 years. This is the detail of the subscription of the Unacademy Plus subscription. Okay, so you can also be a part of the Unacademy Plus subscription. Daily live classes can be assessed by you, and also live tests and quizzes can be assessed by you. Structured courses are there which is categorized for the students appearing for NEET PG 2021 or 2022, or they are appearing for FMGE examination. Those who wish to join the Unacademy platform, they can use the code Dr. Lisa YT for 10% discount. So they can use the code Dr. Lisa YT for 10% discount. There is also merging of iconic subscription. Actually, this is the merging of the Prep Ladder and the Unacademy platform, where you can access the Unacademy live classes, which is very beneficial for the students, and they can also have live tests and quizzes in which the poll is conducted, and you can also know the ranking of yourself in that poll. And you can also have the access of recorded video lectures and Q bank of the Prep Ladder. Rapid revision courses are very structurally created for those who want to excel in the entrance examination. Again, I would like to tell you that those who want to become the part of iconic subscription, they can again use the code Dr. Lisa YT for 10% discount on the Unacademy Plus subscription. Okay, now there is also live test series which is going on the Unacademy platform at 8 p.m. and the 9 p.m. So at 8 p.m. it is for the NEET PG 2021 aspirants, and at 9 p.m. it is for NEET PG 2022 aspirants. Now, those who want to unlock the Unacademy free plan, because for many of the educators, and I am also taking so many of anatomy series, I am taking every day 7 to 9 p.m. approximately every day 7 to 9 p.m. free live sessions, which will be beneficial for you if you want to crack the entrance examination. So you want to unlock it. So you can unlock it by using the code ANAT10. So please use the code ANAT10. You can unlock the free live sessions, and you can see any of the free live sessions of the 19 subject. Okay, now this is the whole schedule of the month for the December. So today also from 7 to 9 p.m. that is a 2-hour session. So today also from 7 to 9 p.m. I am going to take a series of MCQ discussion. So I have started a series of MCQ discussion of previous year NEET PG MCQs. Okay, so you can be a part of this. This will be beneficial for you. So just I will cover up this YouTube session, and after that from 7 to 9 there is a 2-hour session which will be covering abdomen MCQs. Today the session is abdomen MCQs, then I will cover up with pelvis, then head and neck, neuroanatomy, embryology, and also there is series of MCQs for clinical cases, and there is also series of MCQ for clinical cases and also for image based MCQs. Okay, so this is the whole month schedule, and also you can join my own Telegram group. So if you join my own Telegram group, there is the, so at the end I will tell you, this is the Telegram group link is Monalisa Anatomy. So you can join Monalisa Anatomy, and there all the schedule of upcoming sessions has been discussed. Now before starting today's session of cadaveric image, I would also like to tell you about the upcoming batch, which is Target Next 2022. Target Next 2022. So here the batch is starting from 21st December 2020 and will end on May 2021. So the highlights of the batch is that it will cover all the coverage of all 19 subject, discussion of high probable MCQs, coverage of all pattern of MCQs, and doubt clearing session for all the subjects. Okay, so it is starting from December and ending on May, and the batches is called as evening batches because the batches is starting from 3 p.m. in the evening, then 5 p.m., then 5:30 to 7:30, and 8 to 10 p.m. So this is the 19 subject faculty. So these are all educators of 19 subject, and I am taking anatomy in this batch. So you can join this session, and for this you can use again the code ANAT10 if you want to take the subscription of this this series next 2022. So you can use the code ANAT10 for again 10% discount. Download the app, that is Unacademy app, and just write on ANAT10. Okay, so this is targeting next 2022. All the faculties and the educators of the subjects has been shown here. Now starting with the cadaveric image, that is the today's session. So starting with the cadaveric image, so what you can see, this is the ventral aspect of the brainstem. This image is showing the ventral aspect of the brainstem and the important structure. So first thing which I want to write, this is showing, this diagram is showing ventral aspect of brainstem. This diagram is showing ventral aspect of brainstem. Okay, so here the important structures which can be visualized here are the caudate nucleus. This is caudate nucleus which you can see, parts of the basal ganglia. This is the lentiform nucleus. Also what you can visualize here is the other important structures which is also being seen here. So this is the amygdala, amygdaloid body. Amygdaloid body, important structures related with the olfaction and also for the emotions, part of limbic system. The other structures which can be visualized when we see the ventral aspect of the brainstem, here in the upper aspect you can see the fornix, that is the, to be more specific, it is the column of the fornix which is visualized. This is the olfactory tract which is seen here. This projecting part which you are seeing is the infundibulum, which you are seeing. Now moving on to the next. So let's see the next pattern of structures which can be visualized here. So also here we have seen this is the infundibulum as already seen in the previous. This is the infundibulum which you are seeing. Okay, infundibulum, this part. Now other than that, the other structures which can be visualized here, this is the optic nerve. This is the optic nerve. Below it you can also see the another nerve, this one, and this is the oculomotor. This is oculomotor nerve visualized here. Now what is this? So here you can see this, these are the cerebral peduncles, and also you can see the part of the pons. Actually this is the ventral aspect of the brainstem, so you can see this part is, this whole area which you are seeing is the medulla, and this is the pons. In the middle, the depressed area which you are seeing here, this depressed area which you are seeing is the basilar sulcus. This is the basilar sulcus, or you can say groove, and in this basilar sulcus or basilar groove lies the basilar artery. What is located here? Here lies the basilar artery inside. This is the location of basilar artery. Now also on the ventral aspect of the brainstem, these nerves which you are seeing is the fifth cranial nerve, that is the trigeminal nerve. Now this is the pons and this is the medulla. At the pontomedullary junction, the nerve which is visualized here, this is the abducent or the sixth cranial nerve, and lateral to it these two nerves. So let me use black color just to make you understand. This is the nerves which you are seeing. So these nerves are, actually these nerves are seventh cranial nerve and that of eighth cranial nerve. This is seventh and that of the eighth cranial nerve which can be visualized. Okay, now can you see this elevated part? Okay, in the lower aspect, so here you can see two elevated areas, one adjacent to other, these elevated parts. So here you can see two elevations. The medial elevation is the medial elevation is called as the pyramid, and the lateral elevation which you are seeing is the olivary nucleus, inferior olivary nucleus. Okay. Now, the nerves are also being seen like in the junction between this, here you can see the nerves which can be visualized here. So, just adjacent to this pyramid, here the nerves which will be seen here. This side, okay, this is the location. So, you already know this will be the 12th cranial nerve. This is like adjacent to pyramid and just adjacent to the olive. Here also in line the nerves will be visualized from above to down. Here will be the nerves which will be seen, and the nerves which is visualized here from above to down will be 3. And what are these nerves? So, that is from above to down, that will be the glossopharyngeal and the 10th cranial nerve, which is also having the cranial part of accessory, will have the cranial part of which nerve? Accessory nerve. So, this is the quick recapitulation of a cadaveric image of the brain stem which is seen from the ventral aspect. So, important structures is visualized. So, 2 diagrams I have used because all the labeling if done in the one diagram it will become very messy. So, I have included the same diagram and the labeling is done in 2 groups. Okay, this is the first and this is the second. So, this is an important diagram and cadaveric image and specimen which has to be revised. So, because MCQs and image based MCQs come from this topic. Now, I also want to show you another diagram. Actually, this is a cadaveric image of lacrimal apparatus. So, what I am showing you is the lacrimal apparatus. So, this is the diagram of lacrimal apparatus of left type. This is the lacrimal apparatus of the left type. Okay. Now, important structures which can be seen in this diagram, in this cadaveric image of lacrimal apparatus is, let me just highlight it. So, can you visualize here 2 of these structures, then it is joining here and then it is descending down, okay, like this. So, important structures here, what are these markings? So, let me just show you. So, superior aspect, this is superior lacrimal canaliculi, superior lacrimal canaliculi or canaliculus we can say, and just below it we can see another one, that is inferior lacrimal canaliculus, and lower to it this slightly swelled part where this sac like structure lies. So, I am talking about this sac like structure. Okay, just a minute. Okay, so I think I have to write it once more, just okay. So, yes, now I just want to highlight this sac like structure. Can you see this sac like structure? So, this sac like structure which you are seeing is the lacrimal sac. This is lacrimal sac, and this duct is nasolacrimal duct. This is the nasolacrimal duct, which will open into the inferior meatus. Now, other structures which can be seen in this image. So, let me use the same diagram, next one. Okay, so here you can see this is the gland which is shown here, this gland which you are seeing. Let me just highlight it with a highlighter here. Okay, so I am talking about this gland, the gland which you are seeing here, this gland is lacrimal gland. This is the upper eyelid which you are seeing. This is the upper eyelid. Also a part of lateral palpebral ligament. So, this is lateral palpebral ligament which is visualized here. Lateral palpebral ligament. I will show you another diagram in which this ligament is better visualized. Okay, this will be better visualized. Also the part of, can you see this part? So, this is the part of palpebral conjunctiva of lower lid. So, this is the part for palpebral conjunctiva of lower lid. Okay, so these are the important things which is seen in this diagram. Now, I want to show you another diagram. So one more cadaveric image, I just want to give you the details, okay. So this is the diagram when you will see, this is the cadaveric image when you will see after the removal of a part of the eyelid and also the maxillary sinus is opened up. So internal structure, so we will slightly grow internally to see the left side lacrimal gland and the structures which is seen, okay. So left side lacrimal gland structures after the removal of maxillary sinus. So what is the maxillary sinus? Which area is the maxillary sinus? So this whole outline which is opened up, this is the maxillary sinus which is seen here. This is the maxillary sinus. Now here you can see, again you can see here, let me just highlight it. Can you see here two superior and inferior lacrimal canaliculi? This is the sac and this is the nasolacrimal duct, okay. So let me just write it. This is nasolacrimal duct. This is the lacrimal sac. This is nasolacrimal duct part. This upper part is called as the lacrimal sac. This upper part is lacrimal sac which you are seeing. This is superior and inferior lacrimal canaliculi. So this is superior and this is the inferior lacrimal. This is the inferior lacrimal canaliculi, you can say, and this bony edge which is residing just this bony part which you are seeing, actually this part, let me just highlight it with a color. So let me use a highlighter. So I am talking about this part, okay, this part. So this part which you are seeing is the inferior nasal concha. So write down, this is this bony part is inferior nasal turbinate or concave. This part I am talking about, this part, okay. And can you see here nerves and vessels are also, nerves and arteries are also here. So you can see here nerves and arteries has been shown here in the diagram, this structures, nerves and arteries. So what is this? These are infraorbital artery and nerves. These are infraorbital arteries and that of nerves. So these are the things which is visualized here. These are infraorbital arteries and the nerves which is seen in the diagram. Now other than that, what you can see here also, can you see the circular sphincteric muscle which is surrounding here in a circular pattern? So this is the, can you see here this circular pattern of muscle which is surrounding? So this muscle is orbicularis oculi. This is orbicularis oculi muscle. This is orbicularis oculi muscle, okay. This is again the upper eyelid which you are seeing. This is the upper eyelid which you are seeing. This is the eyeball. This is the eyeball which you are seeing. This is the upper eyelid and the lower eyelid. This is the upper eyelid and this is the upper eyelid. This is the upper eyelid. This is the lower eyelid. So these are the structures which is seen clearly in this image. So I think this is all cadaveric images which I have taken out, and I have described some peculiar structures. I have made my attempt to make you understand all the important markings. So one more thing is very nicely seen. Let me just mark it. Lateral palpebral ligament. So this part which you are seeing here, this part is the lateral palpebral ligament. This is LPL. LPL, lateral palpebral ligament. So can I write here the full form? So LPL means, here I am writing, this is LPL. LPL. So I am writing here the full form of LPL. The full form of LPL is lateral palpebral ligament. So I think this is all the important structures which is visualized in this cadaveric image. So today we have seen the lacrimal apparatus from the, after removing the important structures, after some of the important structures which is seen after removing the opening of the maxillary hiatus. Then we are able to see the infraorbital nerves and vessels, as you can see here. We are able to see the infraorbital nerves and vessels. We are able to see also the inferior nasal concha. We are able to see the orbicularis oculi muscle and a part of eyeball and upper lower eyelid lacrimal sac, and also the other important structures, nasolacrimal duct, superior inferior lacrimal canaliculus. This is the external view in which the part of the lacrimal canaliculus which we have seen. Also we have seen the lateral palpebral ligament and the palpebral conjunctivas. Also this is the superior inferior lacrimal canaliculus which is visualized here. And we have seen the ventral aspect of the brainstem, and all important labelings of the structures which is visualized in this specimen has been written. The two diagrams has been taken. So I think this will be useful for you to solve the cadaveric images, which is very important for the coming NEET PG entrance exam, and also commonly asked for the INICT examination. So I am just ending the session with these images, and before ending the session I would like once more to tell you about the platform of Unacademy. Those who wish to join for today's session 7 to 9 p.m. I am taking 2-hour session in which I am going to discuss MCQs of abdomen from the previous year NEET PG MCQs. I am going to discuss, so you can be the part of this. And you can unlock the, if you want to see the Unacademy free live sessions of any 19 subject, you just use the code that is NAT10. So for mine subject and my own free sessions, also if you want to wish to see other session, you can use NAT10. So do use this NAT10 code and see the free live sessions. So my free live sessions are going on every day from 7 to 9 p.m. Okay, and you can join my Telegram group, that is Monalisa Anatomy. So on this Telegram group, that is Monalisa Anatomy, I share all the links of my important classes and also the PDF and notes. Now about my free live sessions, today I am taking abdomen session from 7 to 9. Tomorrow I will take pelvis 7 to 9. Then I will take head and neck 7 to 9. Then I will take neuroanatomy. So today is 17, this is of 18, this is of 19th, and this is of 20th December. So, and after that I will also cover up the sessions for, so I will also take few sessions for the clinical case studies, clinical cases, and also image based or cadaveric image sessions, image based and cadaveric image session. So you can just use the code NAT10 and can see my sessions. If you wish to join and want to see this session of free sessions which is on the Unacademy platform, you can use the code NAT10. I would also like to give you the information about the upcoming session, target next 2022 with me. You can again use the code NAT10 for this, and if you wish to want to be a part of it, you can avail this opportunity. These are the 19 subject educators who are going to complete this session starting from December and ending in December 21st, starting and ending in the May. All the best, and this is an evening session. So before ending, I would also like to tell you that you can use my code Dr. Lisa-YT for 10% discount if you wish to take the subscription of Unacademy. Thank you so much, all the best, and keep studying. Thank you so much, all the best. Thank you.